restaurants, sports teams, bars, private parties. Is there any data on that, or is it all impressions?
Well, it kind of runs the gamut. So, I mean, there are some that, the house gatherings with the dinner parties that the parents have, and then the parents get it and they give it to the kids and it transmits. And it also goes the other way around, where if it's a teenager at a house, high school party, because they're teenagers, they get it and then give it to the parents. So we're seeing it at all levels. Nannies giving it to the families, going out, like you said, to restaurants and stuff like that, but it's not a widespread thing here. I mean, restaurants statewide are, number 2 cause of transmission, but that's not really what I see here. I only see a handful anecdotal.
What was number 1 statewide?
Gatherings.
Just private gatherings.
Yep, and that's what I've seen a lot of. Because when people let their guard down when they only have a few friends over, but those friends are from outside your house and everyone, is careful. And then, the test is only a snapshot in time. So if they get tested, like the day before Thanksgiving, and then they find out 2 days later that they're positive, well, now that 48-hour window is your infection period. Like on Thanksgiving, I got test results back from the Tuesday testing. I had to contact 3 families Thanksgiving morning, 7:00 in the morning, to stop them, so they knew that they had a positive person. Wow. So,
we only have, Tom, if our group is any indication, and I know our employees work, Stanford, Norwalk, Bridgeport, Danbury, all the areas, the vast majority of our group, when we trace it back to their children, and either, a schoolmate or a sporting event or something of that nature, and they caught it from their kids, that their kids were home quarantining for some event, some exposure, and they caught it there. That's been the vast majority of our cases from our employees anyway.
Okay. Anything else, Jen?
No.
Okay, just those on the EOC have heard this. I'll just give you a little hospital updates. Stanford, Norwalk, Yale is an outlier in Bridgeport too, because they're dealing with, Yale has approximately 200 COVID patients in hospital, and Bridgeport about 120. Norwalk and Stanford are running about 40, which is about a third to a quarter of what they were last March, April, but the numbers seem to be creeping up. They, there are 5 to 10 in the ICU. At least half of those, I think, are on ventilators. They always have patients in the hospital who are waiting test results, about 5 to 10 patients under investigation, they call them. And they're seeing about 5 to 10 patients per day in the ER with COVID, and the majority of them are being sent home. The hospitals are offering remdesivir, which is the antiviral, seemingly effective if given early, at least shortening the course and maybe mitigating it somewhat. They're given the option for steroids, which is anti-inflammatory, and it may help prevent one of the significant negative inflammatory reactions of COVID. They're being given plasma and are given the option for plasma. Norwalk is undergoing a study right now with Lilly with a certain monoclonal antibody given to people who are mildly sick and not hospitalized, not needing oxygen, over 65. Obesity will qualify for that, just to see what a preventative this is. It helps. The way it works is the antibody helps prevent the spike part of the coronavirus from attaching and entering the cells. So that's a hospital update.
Thank you.
Human Services. Thank you, Jen. Human Services, Bethany.
Hi, everybody. All right. So we'll start with the food pantry. We continue to have 55 to 60 shoppers at each 2-week distribution. And we are in the process, we are continuing as a drive-up food pantry. We switched back over to that last week. We've had unbelievable success at the St. A's Love Thy Neighbor food drive. So a lot of food. We had less bags this year, but the cash was over $2,000 donation.
Wow.
And people opted to donate monetarily versus a tangible bag of food. But still, we had over 225 bags. We usually have over 300. But the cash donation was incredible. So we thank the St. A's along with the Knights of Columbus. And we currently have approximately 51,000 in the food pantry special funds, which that's where we should be in case. I mean, this would provide us with, I would have to work it out, but probably a couple months, 2 to 3 months worth of food if we had to buy it completely purchasing power and not donations. And for the also ENSA is receiving obviously this time of year the contributions do increase, so it should be a little higher the bank account by next month, which I'll report. For the holidays, for Thanksgiving, we had sides for the food for the Thanksgiving dinner, plus we gave a $25 gift card from Acme for the protein, turkey or whatever they wanted. And that was given through the donations as well as gift cards from Acme themselves, the residents. And let me see, ENSA's doing an unbelievable job of keeping the food pantry along with the volunteers stocked, and it's just going very smoothly, and we're able to switch gears at a moment's notice in terms of how to distribute the food. Choices counseling, this is for the Medicare Part B annual drug enrollment period. That is going on for until December 7th. And Marcy is a choices counselor now. So she and I are both doing the Medicare. We tend to get the Medicare, Medicaid clientele. Lapham, is doing an unbelievable job with the just Medicare Part B without any state or federal programs. And COVID outreach, we have continued communication with our seniors and vulnerable population list. We're focusing on the 80 plus population. We're doing also with Lapham. We've taken the 800 households that we have, 80 years old and plus we're splitting that with Lapham, and we're doing a outreach call again. We do have the volunteer shopper program, which we revved up again, needing volunteers. We have 65 volunteers. We've only had one senior call requesting help, but that is because we did send out an email between with the volunteers asking for an update of what they are doing, and most of them are continually shopping for their initial resident. So that was good to know. And also many of the seniors, if they don't have the volunteer, they have been able to get on to the ordering online or by telephone food delivery, Instacart, Walter Stewart's, all those. So everyone has already been in the process of getting their food delivered some way or another. But we do have that wonderful volunteer outreach, and we're set to go.
Hey, Bethany.
Yeah.
Is the town and Human Services particularly involved with the Fairfield County Dove program that many of the churches participate in at this time of year, food-wise?
We work with New Canaan Country School is doing Dove boxes. This year they decided they do not want to do the food, but they are going to give gift cards. So we will be receiving those. I don't know if that's the same program, but
yeah,
it's with person to person, and they're called Dove boxes.
Right.
Other than that, we do not do with state programs. They deal with perishable foods and on a weekly basis, and we just do not have the capacity to store them perishables for 2 weeks at a time. Plus they don't keep that long, and it's just logistics and timing but I do work with the state knows that, Lower Fairfield County Food Bank and Food Resource. Everybody knows our issue, and it's not that we don't want to be involved, but given our circumstances, it's the 2-week distribution process that keeps.
Right.
getting perishables like that. Also, we are doing a holiday gift bag for the 120 vulnerable population residents. And we are filling a bag that Marcy is going to tell you more about in her outreach. So fiscal year 21-22 budget for our department. Harrison and I are going to be going over that. There is a maximum 2% aggregate increase not to be exceeded. So we have a very small window for increased spending. We will go over the grant requests at a later time on the agenda. And Human Services is working with the AARP tax return program. We're going to again play a role in the appointment making. It is going to be decided what type of program we're going to use, whether it's going to be virtual, on-site, or hybrid. So that we just started our meetings yesterday, and January 15th, this will start. This is when the tax help begins. So we're in a good spot to begin talking with the AARP and getting something in New Canaan to help tax preparation for all ages. It's not just for seniors. Client care, we have a continuation with involved of our cases are just very involved now. There's our steady requests for help with the utility bills. And I'll let the case where Jackie and Marcy will talk about their cases, energy assistance next. And then the holiday program, we've had most generous contributions and involvement with the New Canaan moms, the churches, individuals, businesses reaching out. And this year we gave a choice, no gifts. We didn't want people bringing and coming and pick up gifts, trying to decrease the inflow and outflow coming into the building. So we have given 4 choices to the clients, whether with $50 gift card for each child in high school and younger. And the gift cards are CVS, Amazon, Walgreens, and Walmart. Amazon and Walmart are the most popular, but those will be distributed at the next December 8th food pantry and distribution, where then they will have time, the clients, the parents and guardians to have Christmas shopping taken care of with their gift card. And then Lance is going to go into the public service announcement. I'm looking for the New Canaan Advertiser is going to be showing their weekly advertising, but I'll let Lance talk more about that. Any questions?
Yeah, how many families, Bethany? I didn't get that number in the food pantry are participating right now.
So we have 80 families that qualify for food pantry distribution. Of those, on a distribution day, we're getting about 60 of them.
Okay.
We used to have 60 families that qualified pre-COVID, and we would have like 35 or 40 families come and use the pantry on a distribution day. Some come once a month, twice a month, a few times a year, things like that, but they do qualify. So we have an uptick in qualification of families as well as the number of families utilizing it.
Thank you.
Mm-hmm.
Bethany, could you comment on the testing role that HHS is going to be assuming, which I just found out about late yesterday?
Oh, so when contracts are signed, we are going to be doing the first responder and employee testing for the town. Enza and I will be doing that and working with EMS and the EOC in terms of providing this service for the employees and first responders. So that when contracts are signed, we can start as early as Monday. And it will be at Lapham alongside the public testing. And so we will have access to Russ's wealth of information with his testers. Ross, any more on that? I'm going to learn the process.
Yeah, the registration is the hardest part, but
Okay.
and signing everyone up. But we're happy to help. It's right now. I think the contract is for 1 day a week, 30 to 40 people per day. Right? I think you guys haven't decided on the day to start. Again, Waveney Life Care Network is testing 7 a.m. to 10 a.m. Monday through Saturday. So whatever day that you guys pick, there'll be a team there. If you guys have any questions to help
Great.
assist.
Great.
I think it's easiest EMS, the captain there. Mondays are good for her. I think we're going to do Mondays between 8 and 10 or 7 and 10. Yeah. We'll fine tune it, but yes. So
Great. Thank you, Bethany.
thank you.
Marcy? Oh, you're on mute.
Mute. Sorry,
Marcy?
guys. Good
Okay,
morning.
that's okay. Good.
How are you?
Good to hear you as well as see you.
Thank you. The first thing that we have been working on, Bethany and Alyssa did an amazing job. She helped us make a flyer for seniors. We are reminding them of the importance of social distancing without being total Debbie Downers. They are at the highest risk for COVID. And that was sent to all our community resources and with our phone number and our contact information, a reminder that we are here to help them and we are here to set them up with grocery shoppers. And as Bethany said, we have 65 volunteers who are waiting in the wings for phone calls. So we are so grateful to all of those people. As far as working with some difficult clients, Bethany and I participated in a probate court hearing that we were successful in conserving a resident who was really at risk where she lived, and she is now safely in care in a facility, and we are really happy about that outcome. Very grateful. And last but not least, I have it half set up here as just like a little demonstration. If you guys can see, this is our holiday gift bag. We have so many community resources who have helped us fill it for our seniors. It will go to 120 households. And the people who are, the organizations who are going to participate is the Fire Marshal, Get About, Human Services, Lapham Center, Meals on Wheels, NCL, the EMS, the library, the police, Staying Put, and Waveney Life Care. So we have pamphlets in here. We have some candy. We're going to have a cute wreath that's going to hang from here. And then inside, all of those participants have put information and flyers. So seniors will know who to contact, where to contact, and any needs that they may have that will be in the bag. And that is it for now.
How about the delivery of those?
That we have to conquer. I'm so glad you asked. We do, as I said, we do have 120. If anyone would like to help us and maybe take 10 and start to deliver those, that would be wonderful. We should be done filling them, Bethany, next week, right? I think we're waiting on, like I said, the wreaths and something from the library, and then we should be able to deliver them the week of what, is it the 14th?
Week of the 14th. The fire department said they would help. Alicia, maybe NCL, and it's just going to be a community effort. We do have our volunteer list. We could ask as well, the shoppers. And so once I get the feedback of if anybody in the commission would like to and things, I'm just going to see what's left, and we will get the deliverers out. And once again, it'll be contact free, just at the door. Marcy and I will make phone calls, letting them know that something will be there for them.
Oh, put me down.
Yeah,
Thank you.
Marcy,
Yeah.
put me down for 20.
Oh,
Okay.
thank you very much. That's
You
fantastic.
can
Thank
put me
you.
down too. I'm happy. I'll send you an email and let you know.
Okay, thanks, Jen.
Whatever you need.
Yeah, if everybody wants to email Marcy and just let them know the number that they'll deliver.
That would be great. Thanks, guys.
Yeah, that's kind of a rewarding thing to do. It's like a little bit of hands-on manual labor, whatever you want to call it, as opposed to sitting back and going to meetings.
Right.
The Thanksgiving gifts, which four of us distributed 2 each, and plus Bethany and I think did also, maybe Marcy, Jackie.
Yeah.
So they were Walter Stewart fixings, which with turkey, vegetables, potatoes, and a slice of pumpkin pie, which was a nice little delivery. People were receptive, happy to get them. Bethany, did the fire department finance that?
Yes. So every year they do, they finance that as well as Christmas trees, which they dropped off yesterday. 10 to 15 Christmas trees per year that go to mainly families with children, and they will start picking them up today. So
Yeah,
that's what the fire department
Yeah,
does.
I don't think they got the recognition for that. I know I didn't tell them. I was saying it was all coming from the town and Health and Human Services.
For what, the Thanksgiving?
Yeah.
We put it on social media that
Okay, so they
and it
were
goes
aware.
out today. Enza has it on deck. So that's the next one, a picture of the fire and of the commission deliverers. And so, yeah, that'll go out.
Okay, great.
Go on social media.
Yeah, Instagram's big.
Thank you.
Yep.
Marcy, anything else? Jackie, Youth and Family Services?
Marcy, I love the bags, by the way. They look great. People are going to be really excited to get those. And just to mention about we were getting 12 Christmas trees this year. My families were just so happy to get those. The kids are very excited. It really does help them out every year to get those. And we try to rotate who those families are. And this year we just really picked, the most needy that have maybe had, job interruptions or losses. So that's, or maybe they had COVID and just were out of work for a while. So that's really exciting. Bethany mentioned fuel applications. So, we've talked about this kind of every call. They're slowly trickling in because I did a bunch in the beginning and then I had 2 that I was able to do yesterday. This is a tough time for people to pull this paperwork together, but we were able to get those in. Hopefully they'll get certified in the next couple of weeks, but it really helps them with either money towards paying for propane or oil, or it's a stipend that goes to Eversource, which would lower their monthly bill every month. In addition to that, we were able to Enza help me with a low budget worksheet for a family that heats with Eversource. What that is Eversource tells them an amount they have to pay every month, and this family is saying, there's no way that I can come up with that money. So we put in some data into the portal and ask for a lower amount every month. And so we have to check back to see if that was accepted. There's a possibility that it wouldn't be. So I don't know what that family would do, but I will check back. I think I have to check in a week. And also in addition to this, we had a pretty significant mental health intervention for a family with a young teen. We were happy to kind of be involved. It was a family that we had talked to in the past, and then they came back to us to know we were a support to them. So it was really nice that they remembered and got in contact with us, and we were able to help intervene there. So that was great. Also, I know the school, not to give too many details, we record this. Hello? So the schools also were happy to know, they had contacted me about a DCF issue, and they were happy to know that we were involved with this family and this family was well taken care of. So that was yesterday. That was great. Also, I had a new family reach out that's filling out a financial assessment. Hopefully they can get that in and can attend and be approved for our December 8th food pantry. That would be a really great offer. Other than that, I mean, we're just, new things are coming in daily and we're just trying to figure it out. I think our teamwork is really good. But does anyone have any questions?
Good.
I also want
one thing I wanted to comment just on the domestic violence, and then I'll let somebody. I know we had talked about, sort of like our numbers when I had submitted those to everyone. It looked like they kind of stayed flat or maybe had gone down during the COVID. what we had learned, we had, I know she'd stepped down in her role in the last couple of weeks, but Karen Jarmock, who was the head of our CCADV, which is like the Coalition for Domestic Violence for the state of Connecticut, she was on my call last month. I know Alyssa probably tuned into that, but she talked a lot about how that looked similar in the state. Like police departments weren't being called as much, but numbers to local domestic violence crisis centers were going up. I think ours in New Canaan were up 65% as far as the DVCC, who's our catchment area resource. Their numbers had gone up for people looking for, counseling, court advocacy. But funny enough, the police, and I think we could, we had to anecdotally say, people are stuck at home. They don't have anywhere to go. They really probably don't want to intervene with the police because that might uproot kids and families when they have nowhere to go during COVID. It's like not easy for them to go stay with older parents or because of health issues. So interestingly enough, I thought, I was kind of thought, wow, those numbers should be higher, but that's really what they're seeing. People are going directly to get that counseling. And the nice thing we know over this time is the telehealth platform has provided a lot of great access for people to do that in the comfort of their own home, their car. So anyway, I just wanted to share that because that was interesting for me to hear from the head of that coalition. Did somebody have a question that I interrupted?
Jackie,
Yeah, Harrison?
now just the reception is not great, which is a reminder that New Canaan employees, including HHS, are on a hybrid system. And obviously, you're zooming in from home, right, Jackie?
Yeah, but I have a Google Mesh. It should be working well. I don't know. Usually it's great.
Just go over this. The incidence in New Canaan is up of domestic violence is up about 65%. Part of
65% to the DVCC calls. So it's counseling for directly to the Domestic Violence Crisis Center, who later in this call is one of our grant requests. But their numbers have gone up with people in New Canaan calling them directly.
Okay. Yeah, we in the spring we knew it was up all over, although some people were not reporting. But those numbers are compatible with what's been going on in the state we're in.
Harrison?
Yes.
People on this call should put themselves on mute if they're not speaking, because that creates feedback and messes up everybody else.
I agree. Everyone who's not speaking on mute, please. Anyway, thank you, Jackie.
Harrison,
Any
I want
report?
to add one thing.
Yes.
I think yesterday, the Garden Club of New Canaan, they are donating 6 trees as well. So our little wait list of people that wanted trees, we're able to help them out too. So the Garden Club is another unbelievable resource. And it's just unbelievable to see the town and the impact that the COVID is having at the same time. As I said before, it's a silver lining, and we just see really how well this town comes together. And we're glad Human Services is becoming a part of a go-to focus of where they can help. They're knowing to call here. So just wanted to put that out there.
With Bethany, is 6 the full need, or is there more of a need than 6?
No, 6 is good now. What happens is the sooner we know that we're going to have this donation, the better. A lot of people have already gotten their Christmas tree or plan to, especially with kids. They want to get it up right away. But more and more people know that Human Services will be having this, that we do have this program each year. But this year we are all set at this time.
All right, if a larger demand comes in, would you let me know?
Yes.
I am a member of the Exchange Club, and we do the tree, and I'm sure we can find a way to have some purchased if need be. Just let us know.
Thank you.
I think that's great, and that's compliments to you, Bethany, and Marcy and Jackie, because your awareness is increasing by the day. So, people funnel their benevolent sorts in your direction. So I think that's great. And it's great for the town of New Canaan.
And we're working on the outreach aspect of human services, and I think it is paying off. I really do see an uptick in people knowing to call us for where to go, either to give or to get, to receive. So it's great.
Yeah, agreed.
Thank you.
Any reports from the commission at large? Next item, old business. Holiday programs, I think we've discussed that. And one thing, Lance, so the announcements with alcohol, substance abuse, et cetera, will start this week, correct?
Yes, can you hear?
In the advertiser, I think we're frozen.
We're
Or maybe I'm
frozen. Lance, let me speak and then add in.
Can you hear me at all?
Could hear that.
Yeah, we heard that.
You can hear me. You can hear me.
No, I think, go ahead, Bethany.
Okay, I'm going to go ahead. So
Bethany,
Lance,
can you hear me, Bethany?
yes.
Hello? I got the
Okay.
TV guy upstairs and he's dismantling everything. So
Okay.
Timing is everything.
I just put Lance on mute. Okay. Well, sorry, Lance. Lance, as always, is doing an unbelievable job with he started with that New Canaan Advertiser again, and they've graciously given us a huge discount on the public service announcement. Week 1 starts today with the first ad, and then we go to week 2, week 3, week 4, every Thursday, and it is usually what it has been in the past, showing about drinking and driving and where to go for help, and each week is different. Lance, maybe.
I'm sorry. Can you hear me?
Yes,
I can't hear.
unmute yourself, Lance.
Okay, can you hear me?
A little bit.
Oh, Bethany, can you hear me?
A little bit,
Okay, I'm
Lance.
talking to you on phone. Okay, the TV guy is here right now and he's dismantling everything.
Yeah, don't worry. It's okay.
We heard that. Lance, question, the New Canaan Recovery Corps, they had an advertisement in the advertiser last week. Is that part of New Canaan Cares, or maybe you know that, Bethany?
Is that what they're calling? Oh, the New Canaan Cares is the coalition. Jackie, are you on this?
Unmute, Jackie.
Okay, hear me?
Yeah.
New Canaan Cares they have an LPC grant that they get every year, and they have to run a coalition, so they have to gather the community. So when Ellen Brzezowski was the executive director, she would use the meetings that I was assembling, and they were okay with that. But being that there's COVID, I'm not looking to resume those meetings. So they've had to assume those meetings, and they just kept it the coalition name, which is fine. Because that's what it's called in other communities. It is called coalition. So they're doing that now, and we're meeting once a month. And actually, I think we met in the last 2 weeks, and then we'll meet again. I think in the coming week. Is that what you were asking?
That's good information. Specifically, I think we can move on. It was just where New Canaan Recovery Corps was coming from in their advertisement.
I don't know the New Canaan Recovery Corps. I don't know what that is.
Okay, let's
Paul Reinhardt might know. I can check in with him.
let's move on. Lance, I hope that your TV, et cetera, is working after this. Okay, we're into new business. Jim, I think we can put old business, new business, whatever, by week and have one of your columns and categorize it as such. Anyway, so Jim, if you could just discuss the mental health, navigating today's normal, and where we're going with that in terms of the role of the commission and this becoming a marketing tool or an enterprise in and of itself.
Right. Actually, I want to talk about two things in the COVID coping education and resources. One of which is the navigating thing, which I'll come back to. But I want to, everybody should know that the Let's Talk About It group, which is basically sponsored by the New Canaan Foundation, but includes everybody and anybody that has something to do with adults and youth. And so there's now established a monthly schedule of themes, which we will participate in. There's an editor who will sort out what's going on. We're hoping that actually our first navigating program of stress and anxiety management by Silver Hill and Dr. Handler will be one of the first programs up in January, but there'll be a theme for each month and then 2 or 3 different execution programs against that theme to seniors, to youth, to general, etc. So that's now moving along after a long postponement, basically. The bigger thing is in the navigating side. We are tomorrow start program number 5, happiness as a natural high. We're going to look at it in a minute, as at least a small excerpt from John Hamilton, who's a national substance abuse expert. And basically what you're going to get is an entire semester of Psych 1 coping and happiness in a 25-minute presentation by John. I hope you'll all look at it on either Channel 79 or the YouTube. Fundamentally, we don't know exactly how many people have seen the programs. It is Bob Doran, who looks after 79, among other things, and the YouTube clicks. We've had at least several hundred for each program. So that's good. The big thing is that AARP Connecticut up in Hartford has picked up our programs and will be running them as a part of the statewide network program probably in March or April of this coming year, with the idea that they will run our basic program, let's say stress and anxiety management, which is a 30-minute program, and then have 15 to 20 minutes of dialogue, questions and answers that's done on a live basis. So that's a big step forward. And Bob and I are meeting with them next week to begin talking about the details, and there's some legalities involved. However, the biggest legality, which I need the commission's support on, is the fact that the navigating series, all the talent and the program music and et cetera is all owned, as it were, in quotes, by the Health and Human Service Commission as the producers, basically. So before we go too far, I wanted to ask the commission for either a vote or just a general survey of support, because I want to make sure that it's okay to be talking commission as to how we could work these programs that we've already produced into the AARP Connecticut state network. So I'm not sure whether you want to do that as a motion or whether just speak now or forever hold your peace kind of thing. I'll leave that up to Harrison. But nevertheless, the idea was we're now being picked up on a statewide basis, not only from AARP, but from two other seniors aging type groups. So that's good.
No, the production's just a significant contribution to society, basically. New Canaan and beyond, and I think they're realizing that. But Jim, where do the finances come in now? With the state getting involved?
Well,
Is it
from
a
the
pro
standpoint,
bono enterprise, or are there some finances involved?
there should be no finances involved from the town. AARP has their own budget, and I think their volunteer moderator in the programs that they run every Wednesday, which are the state network programs on coping with COVID. I think that's all done on a volunteer basis. And as far as I know, again, there's no production expense that's not covered either by AARP's budget or is done on a volunteer basis. But there's no cost to the town. We'll make sure that that's part of the drill.
So no money going out. And I think part of my question was money coming in.
I don't think based on the fact that AARP Connecticut is a fairly marginal business in terms of revenue, I don't see that the plan is not to charge for this. If we have an opportunity, obviously we'll take it, but it's basically we'll produce creative product that will be wrapped in their media networks and their moderator to run the question and answer. So I don't see that that's going to be either a revenue producer or an outflow. Certainly not for the town.
Okay. Any questions about that? For more business-oriented people?
If not, maybe we'll roll 3 minutes or 2.5 minutes of John Hamilton's introduction and Steve Johnson's application. And so you get a flavor for what's going on here tomorrow.
Go ahead, let it roll.
We need to unmute.
To be compulsive in our brain, but it's disconnection to our body, disconnection to our feelings, disconnection to others. We need to make these connections. That's how we can increase this dopamine capacity. We also need to have a sense of acceptance. You know, in a lot of the work we do in recovery, it's about being able to accept life on life's terms. And the litmus test for a strong recovery program, in my eyes, is the ability for people to accept life on life's terms and have a sense of gratitude, have a sense of serenity. If somebody's struggling with attitudes of relapse, it oftentimes has to do with a lack of acceptance of themselves and others. And if you forgive others, you ultimately will learn to forgive yourself and have gratitude. Gratitude is something that's more sustainable than oceanic joy. If you have gratitude in life, wake up every morning and be grateful for what you have in your life versus resentful for what you don't. It's a great way to start the day. And ultimately, we all need hope, especially during these trying times.
Certainly in this new normal that we're living with, the ability to be isolated is all too common. And the way out of that presents sometimes a challenge or a problem for many of us. And I think what we heard today is that there are some very viable ways, viable tools to address that connection. Simple things, I'm sure, and you may agree, before the arrival of the new normal, I know I was not aware of Zoom or FaceTime. I now live on them. I find them a great way to connect with other people. But more importantly, understanding that we and you are not alone in this new normal. The empathy and the feeling that I'm not alone and you're not alone provides a foundation for developing that happiness. Simple steps that can be taken to communicate with others, appreciate and understand the space they are in turn, be assured that they understand the space that you are in. And so we're experiencing a common feeling, ultimately reaching towards either isolation or through empathy and connection, creating a natural high.
Guess who's up next, guys? I wanted to make a comment, first of all, that John Hamilton's comments ought to resonate and be very familiar to Mr. Lance Minor, because although his business is basically behavior modification for alcoholism and substance abuse, it basically has never been more relevant than to right now as to COVID coping. So nevertheless, it's going to be one of our best programs until we get the next 2 weeks from tomorrow. Will be our own Bethany and Marcy. And we're into the happiness phase of the mind and body connection. So anyway, please tune in. And obviously we're getting some traction here. We'll see where we go from here, and I'll let everybody know how the AARP negotiation, as it were, comes out. Thank you.
Thank you,
Jim,
Jim. And
can I
let me
just-
circle that on my calendar for Bethany and Marcy. Okay, done.
One question. Will somebody be getting some kind of a count as to how many people watch the YouTube, or I guess, I don't know if we get 79, but just some idea of the reach that we're achieving?
Yeah, Bob is chasing that down. There are ways of getting YouTube hits on a normal basis. The problem is everybody and his brother now is on YouTube. And so their YouTube admin group is way behind being able to deliver that. So Bob keeps track of a kind of an ad hoc basis on both Channel 79 hits and YouTube. And so he's saying it's a couple of hundred for each program. But that's what he says about all of his programs on 79. So it's suspicious. No, I think it's probably right just based on people that we talk to. So we never will know absolutely. It's not a Nielsen, but at least we're making some connections.
Also, is it John Hamilton? He addressed the men's club group earlier in the year and was very impressive. So it's substance abuse, it's alcohol, but it's also relationships and connectedness from marital discord, family problems, etc. So I found it very informative.
One of the things, Harrison, that's the lead in that Dr. Handler does to John's presentation tomorrow is the fact that alcohol consumption in the state of Connecticut in March went up 400%. We haven't seen a number since then, but we know it didn't go down.
Well, I happened to, a couple of months ago, I went to one of the wine and liquor stores in New Canaan. I asked him how business was. He said, it's like Christmas on steroids.
Yeah.
That's compatible with those numbers. Next item on the agenda. Thank you, Jim. Grant requests. We have six requests totaling about $177,500. Bethany, do you want to run through that? Or do you want me to just state what they are? I think we have to vote on these things.
Right. I just want to show the screen and go through. We don't have to go through each one, but just to Harrison.
Make us aware. Yeah. Go ahead. That's fine.
Okay, let me bring you up. Hold on. And share screen. Okay. Can you all see that?
Yes.
Okay, so let me speak a little bit. The request Child Guidance Center. These are all the grants I'm showing you. They have made a request year after year. We have given out grants for each of these. There's not a new agency in this, in these six that I'm going to show you. But just to let you know, the grant request for child guidance this year was for $7,500. Last year, they asked for the same amount and we gave them $5,000. Historically, we would give them $5,000 every year. I sent the financials to you. This one, so if you need more financials, we can get these to you. The Human Services Grant for Domestic Violence. Every year they request 10,000. This is the crisis center that Jackie was talking about in terms of the uptick, 65% uptick in phone calls coming in. Jackie, did you say that was from New Canaan, 65% up?
Yes.
Or okay, so they requested 10,000 last year.
Yes, yes. Sorry.
No problem. And once again, you know, we historically have given them 5,000 each year. The Get About, 50,000 is what they usually ask us for. They asked us that last year. They continue to ask us for the same amount, and we awarded them $46,000 last year and the year before. Here are, if anyone needs these financials, I have sent them to you. And but if you have any questions, we can go back. Kids in Crisis, this was the largest uptick. They last year they requested 60,000. This year they're requesting the 88.9. This is basically the pay that goes to the counselor that they hire to cover New Canaan. This looks like it's including the insurance package. Last year they asked us for 60,000. We awarded them 56,000. They did not add on the health insurance package last year, if I understand this correctly. Moving on. This is the Teen Talk report. This is what the counselor or the hiree at crisis. This is what the program covers and what we are paying for.
Hey, Bethany.
Yeah.
You should talk about why the human service, this is in the human service budget instead of the Board of Education budget. That's very critical.
Okay, good point, Jim. The fact is they don't want the Board of Ed to be involved. You know, they want to keep this separate. So any information, whatever, remains separate from any type of school counseling. It gives the child a sense of privacy, as well as not having to the Board of Ed, the counselor being under the Board of Ed. It creates definitely a stronger link for the counselor, kids in crisis, helping the child in need or family. And okay, this was the Meals on Wheels. I'm sorry. Did a little bit of. Okay, and then the last. New Canaan Cares. Last year, they requested 18,000. We awarded them 18,000. This year, uptick a little to 21,000. And once again, their funding is exactly the same it has always been. And they continue just an unbelievable promotional, educational programming resource for the town for all ages. So nothing new and different here. All these agencies, they're running on such a thin budget, and a lot of their donations and contributions, they're lacking this year in terms of that. And so the fact is, you know, they're not requesting much more except Kids in Crisis. My recommendation is working with our budget that we have to work within. I would like to see that we maintain the budgeting, the awards that we gave them last year, and hold flat our, I believe it's 140, what it came out to, but flat last year, like about $140,000 worth of grant requests and funding. The finance pays them out 6-month periods, 2 checks that are dispersed, distributed to these. to these very important organizations. I think it's well balanced in terms of the Meals on Wheels and Get About and domestic violence. Focuses more on the seniors, adults, and the child guidance. Domestic violence, kids in crisis, New Canaan Cares is more focused on family and youth. So we've got a good balance going, and that's my recommendation.
Actually, you mentioned the $140,000 is the total that was in the budget for outside services this year, this fiscal.
Okay, yeah.
And we probably will get at best 2% times 140,000, or let's say 145. If I add up your recommendations, not what was asked for, but your recommendations of just the requests that are before the group right now, that's about 130,000. So, would we have any money left for a disposable grant, as it were, of what would be basically 10,000 or less for the rest of the year? So if we go through the budget as proposed and as you recommend, will we have any money left for discretionary?
So this is the wiggle room. We do have a line item that's public health services, mental health programs. We could have it go there. Anything left over, but that's the wiggle room.
Well, that wiggle room is $10,000 though, right?
Right.
Most, yeah, okay. So I just want to make sure that everybody understands what we're dealing with here. Reality.
Do we need to get this decision now or shortly on this? What's the timing?
I have to present, by December 11th, I believe.
Okay, so it's imminent.
I have to present the budget for human services beginning that process.
The only thing that looked, most of the agencies just asked for what they asked last year and probably are expecting to get what they got last year, which is usually less. But the one exception to that was Kids in Crisis, which wants a large bump, I guess, to cover the cost of health insurance for the counselor.
That's what it looks like, that the health insurance aspect has been added, because that's the salary, I guess.
The big jump, it's like 28,000 or something like that. Yeah. Which, that's kind of a big nut to swallow. So any thoughts on that? Because historically we have not paid for that. I guess they cover it. That's a big number. I don't know whether that's the right number, but.
Well, hey, Tom, historically, they always ask for a big number to cover the entire salary. And historically, the town basically pays around $50,000 as a token, basically, of how we appreciate how important that function is. But they have funds from outside through the rest of Fairfield County and their other fundraising that typically takes care of the gap for the town of Canaan. So that's a good deal for us and historically.
Yeah.
Thank you.
But my other question on that, Kids in Crisis, if that counselor just left, would the schools be up a creek with handling kids that?
Absolutely, yes. And because we've had lapses in that, having someone in that position, and like the social workers already have a caseload. They're kids that have IEPs, 504s, so they are, already their day is spent counseling those kids. So no one, and the guidance counselors, as we know, do a lot with like colleges, but no one is meeting with the kids if there's substance abuse issues with friends, domestic violence issues, and we know that that's a lot of kids. I think they noted, if you look at the report from last year, 87 kids, and that was, most of that was COVID from March on. That's a lot of kids, that need help, and it's been higher numbers when we've had school, full in session school.
Hey, Jackie, on a bigger basis, what I remember within the past that the number of youth suicide way up. Do you remember those numbers?
No, I do not. But I know that the state of Connecticut has put money aside to look at that, for all age groups. But I know, we just had one in Wilton, New Canaan, unfortunately, we've been lucky, but we've had attempts. And I mean, I spoke to a guidance counselor at Saks, and that was a few weeks ago. I mean, she had to call mobile crisis. That's the child guidance. That's the funding they're asking for, 5 times in like 1 week. And she had several committals, which means kids that have had to go inpatient, and she's dealing with 7th and 8th grade. So, I mean, so the numbers in high school are going to look even greater.
I want to show services provided by the Teen Talk counselor. So this is where the salary is going, to give you a little bit of a rundown.
Well, Bethany, on one hand, we don't want to lose this person. On the other hand, they do have other sources of financial support. So it's the balance here.
It is the balance. We've just never paid. We've never paid a complete salary. And like you said, they receive other funding resources, and they do pool their resources. And so I just think
one thing I'll add to this, because this is not a new discussion of the fact that it's a very large part of the New Canaan budget. Each time we've tried to go below 50,000, they would threaten to pull that spot. And everybody knows, including the head of the board and the chairman of the Board of Education, that this is a critical role. So I would always go for the 50,000 and then hope that they will find the funding from outside their other resources. But basically, not a new conversation. And at some point, there is a level of pain which the Kids in Crisis Management and board will not bear. So we just have to be alert to that. Thank you.
Based on that, I think we should go ahead, approve the allocations in accord with what Bethany said, which was last year's, and then she can speak to Kids in Crisis and get a better sense of what's going on. We have, a week to revisit this issue, which we could do via email or Zoom or whatever was necessary. So I will move to accept the budget as proposed by Bethany and compatible with last year's budget.
Second,
All those in favor?
aye.
Aye.
Any nays? Okay, approved as is.
thank you.
Thank you. Moving down the line, commission members and terms. I did speak to our first selectman, Kevin Moynihan, about 3 commission members whose terms are expiring. That's Alyssa, Alicia, and I, and we are all interested in continuing with Health and Human Services. However, there is going to be one minor change. Alicia, who's been phenomenal with the minutes, and she's done that for the last 2 years. She is stepping into a larger role outside of HHS, being the president of ABC House.
Oh, wow.
She is asked to be relieved of her job as recording secretary. And so I'm going to throw that out to the commission and see how many volunteers we get. Don't all speak at once.
I'm happy to do it if no one wants it.
Going once, going twice. Thank you, Alyssa.
You're welcome.
Well, don't worry, you don't have to do today's. That's Alicia's handing that one.
Perfect.
Thank you so much, Alicia, for your service with this. It's been phenomenal. You've done a great job with it.
Hey, Harrison,
Yes.
classically, December is the time we elect a new chairman of the commission also. If you're going to stay, are you going to run again?
I'll leave it up to the commission. I didn't get any feedback in that direction from our first selectman, but
When do we elect the chair? Is it now or is it in January? What's the protocol?
I think usually it's December, the first meeting in December, which is usually chaired by the first selectman.
Okay.
In this case, I don't remember now. I think it was January or February because of the
Yeah.
chaos basically in the commission and staff that we didn't get around to electing Harrison until January.
Well, would it be out of order if I nominated Dr. Pierce for another year?
Not at all, and I'll second that.
I'll close my eyes and ears. In fact, I'll open it for discussion.
All right.
Anyone, maybe we have to call for a vote on that.
Yeah, I think you do.
Don't worry.
Well, you have to call for the vote. That's why classically the first selectman calls for the vote, but since you're chair going and coming, you can call for the vote.
Vote please for Harrison Pierce to continue as Chair of the Health and Human Services Department.
Yes.
Commission, correction.
Aye.
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 Harrison, thank you so much.
Nay, but the majority has it.
Yep.
Jim, it's so great to have you on this commission for so many reasons, and your seniority and experience is just one of them.
Yeah.
Last item is the calendar. So you all got a copy of the calendar? First Thursday of every month, no meeting in August unless times demand it. And all those in favor of the calendar as is written?
Aye.
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 Any opposed? No. Okay, calendar is passed as is. Thank you so much for a great meeting. And again, Alicia, can't say enough. Thank you for the work over the last couple of years and the work that everyone is doing here. And Alyssa, good luck going forward. And have a great, happy, healthy Christmas, Hanukkah, New Year, whatever. And we'll see everyone at January 7th, our next meeting.
See you next year.
Good.
Thank you. Thank you.
Thank you, everyone.